And also, it's a bit strength training. You know, from an evidence point of view, is similar to running. People panic when they taper that, well, in 2 weeks I'm going to lose everything.
Yeah.
It's the same with strength. We know we can hang on to strength quite well, but even just a very small dose of strength really maintains strength for longer, doesn't it?
Yeah.
So, yeah.
And you might 6 weeks out, 8 weeks out say, actually, I'm just going to strength train once a week now because I need those extra recovery.
But we know it can maintain
But it will maintain it quite nicely. And then when you've recovered from your marathon and you're deciding what you're going to do next, you could then say, I'm going to do another block of more intense strength training while I'm not running so much. And really build a bit more strength ready for whatever you're going to take on.
I suppose, obviously, as physios, I'm just thinking about some of the patients I've seen this week. There's also that thing where if you have had previous injury, it's probably worth getting that checked out 2 months before you even start your training, because we would be able to then give a specific rehab program to try and prevent that pain coming on when they start running.
Yeah, I think
that would be ideal, wouldn't it?
It would be ideal. If you've got the means to do that, I think it'd be ideal, because you could, like I said, we know that, again, if you're choosing your strength plan, it would be useful to target previous injured areas and sort of try and make them a bit more resilient. And in clinic these days, we have the ability to test. We can look at individual muscle strength. We can look at force plate data. So we can look at whole leg strength, and we can say, actually, although that injury was 9 months ago, you're still quite a bit weaker on that side than the other. So let's definitely work on that in the run up before you start your plan. So if you can, I would 100% recommend something like that.
And that links us in really nicely to why people come to see us, which is they have pain. Now, if you're going to train for a marathon, you're going to get pain at some point. There's no doubt about it. But what I'm really interested in from your experience is, what are the pains that people should be concerned about, and what are the ones that they can ignore? So if we talk about the ones they should be concerned about, that will probably take care of the other part.
It will do, yeah. So I have a few sort of guidelines, that we call them, that I would say. Some of it comes from things like tendon research. So the classic things with tendons, and you could say sort of low level other soft tissue injuries, is if you've got a pain that is very low level, if you use a classic 0 to 10 scale, it's sort of 2 out of 10 pain. And it doesn't stay there for a whole run. Maybe it warms up and it doesn't linger into the next day. And you're monitoring it, it's not getting any worse. We can keep going with that, basically. But the minute you're sort of seeing, actually, this is spiking, I'm now getting more significant pain, or I run on a Monday, I'm still aware of this pain by Wednesday, for me, that's a sort of little flag saying that's probably something you want to go and get checked out sooner rather than later. I think if you have a pain that's quite sharp or catching in nature, I think those sorts of pains are a little bit more sort of bell ringing than sort of the lesser sort of more just niggles and dull aches and things like that. I think if you have a pain that's very much impact related, so on every time your foot strikes a ground, you're getting a very significant, consistent pain.
And that gets worse as you run.
That builds and gets worse, and then maybe sort of lingers for a while afterwards. And it feels not, often those sorts of pains, we're maybe looking at towards maybe bone stress type injuries. They don't feel right. People tell us they don't feel right. But people will often try and ignore them for a couple of weeks before they go, actually, now this was sort of only getting up to a mild awareness, and now it's quite significant when I run, and it's there for the entirety of the run.
And then now I'm limping afterwards.
So that leads straight to the next thing. If you have a pain that makes you in any way change your normal running style, I think you should get it checked. So if you notice you're chopping your stride down, you're shifting your weight from your heel more to your midfoot, you're running sort of with you're having to take a longer or a shorter stride to try and manipulate that pain. I think you're already at a stage where you're trying to work around something that is probably not going to get better unless you go and get it looked at. So anything that's sort of, impact related pain that's getting worse, pain that's regularly above a 3 out of 10 that takes a long time to settle into the next day and the day after, and anything that sort of makes you chop and change how you're running, I think those things need to be sort of looked at sooner rather than later. Because most people have the challenge with treating runners is they all come in with obviously with marathon runners, they come in with their deadline. And my deadline is this race on this date. So we need to be better as soon as possible.
And every day that's going, they're getting more anxious because they're missing training sessions and that sort of thing.